Good morning, everyone. So I am here today, this morning, to give a lecture on telemedicine in OBGYN and gyne-onco practice. So this is the outline of my lecture. First, I'm going to discuss the basics of telemedicine, what is telemedicine, the benefits, limitations, and barriers. So also, I'm going to talk about what the doctors need to know, what our patients need to know about telemedicine. I also give some issues on medical legal issues on telemedicine. And lastly, the application of telemedicine, especially in OBGYN and in oncology, gynecology. So these are my references. The primary source of this lecture is the UP College of Medicine Medical Informatics Unit project called Telemedicine Guidance for Physician in the Philippines. So this is a five-part guide on the use of telemedicine in the Philippines, two of which I was part of or I co-authored. I also took some information from this book entitled Telemedicine and Connected Health in Obstetrics and Gynecology. Some information also came from the WHO guides on telemedicine and from ACOG committee opinion on telemedicine. So last June 2020, DOH and UP Manila released a joint memorandum circular on telemedicine practice guidelines. And the medical informatics unit of UP College of Medicine five-part guide were adopted by the said circular. So you can see the five-part guide in the references. So we were very happy about this. So these are the five-part guide from the medical informatics unit and the objective of each part. So the part one, the objective is to determine who could practice telemedicine and the minimum competency and equipment needed. Part 2, how the teleconsultation can be carried out appropriately, safely, and efficiently. Um, part 3 is the teleconsultation in the patient's perspective, and so on and so forth. Okay, let's talk about telemedicine. So according to the WHO, telemedicine is the delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communication technologies for the diagnosis, treatment, prevention of disease and injury, and also for research and evaluation, and for the continuing education of all healthcare providers. Whereas teleconsultation, which is a part of telemedicine, is consultation done using telecommunication to diagnose and to treat patient. So according to the American Association of Family Physicians, telemedicine refers specifically to remote clinical services like teleconsultation, telemonitoring, whereas telehealth refers to a remote non-clinical services such as provider training, CME, or public health education. So basically, this webinar is actually a telehealth activity. So for the purpose of this lecture, I will use telemedicine interchangeably with teleconsultation. So who can practice telemedicine? So any physician with a valid license from the Philippine Professional Regulation Commission can engage in telemedicine with patients physically residing in the Philippines. However, it is stated in the Medical Act of 1959 that the practice of medicine is to physically examine any person and diagnose, treat, operate, or prescribe with any remedy for human disease, injury, etc., etc. So, is doing telemedicine illegal or a violation of the Medical Act? So, DOH and the National Privacy Commission in the advent of this pandemic released a joint memorandum circular last May 2020 covering the practice of medicine with telehealth. So since the start of my private practice, I engage in telephone consultation and exchange of laboratory results through SMS or mobile messaging app. Little did I know that it is already a telemedicine. So these are the different classifications of telemedicine. Based on mode, you have the video, the audio, or the text. And based on timing, you have the synchronous and asynchronous. So synchronous is a real-time telemedicine using video or audio call. Asynchronous is sending documents prior to the communication, and communication is through text or recorded video or audio. So telemedicine can be categorized depending on the purpose. So it can be a follow-up or a first consult. So in follow-up, so you have a prior patient to physician encounter that can aid in the success of the virtual visit. So first consult can be as a triage for a potentially infectious public health disease like the COVID-19. So later, I will also discuss the application of telemedicine depending on the first consult or follow-up. So telemedicine can also be categorized depending on the persons involved. So is it a patient to physician communication or physician to caregiver communication? It can also be a physician to physician, which is somewhat a referral system, or a physician to other healthcare professionals like nurses or midwife in a remote location. So these are the different types of telemedicine. So I talked about synchronous and asynchronous a while ago. Synchronous, this is a two-way or a real-time communication. And asynchronous, you store or you record your communication and you send that for which can be uh, listened to or in a convenient time. You can also have a remote patient monitoring for which in a remote location, the physician can monitor the patient. And also the M-Health or the mobile health for which it is using the mobile app, the patient can monitor herself without the supervision of the doctor. So these are the benefits of telemedicine. So it improves access. So since even in our different two locations, uh, consultation can be done. So you can access the doctor in a very remote location. It is cost effective. It improves care delivery because traveling is not a factor, and it improves care quality. So what are the different barriers of the practice of telemedicine? So one, of course, the infrastructure. You have the hardware, the software, electricity, especially the connectivity. So there are areas in the Philippines that do not have internet connection. Um, Next is the knowledge and skills. So for both healthcare provider and the patient. And lastly, financial cost. So because sometimes software can be, or even the hardware, the gadget they're going to use, it can cost, it can be, sometimes it can be expensive. So what are the different causes of malpractice uh, in telemedicine? So one, miscommunication between patient and physician, because, for example, you have a choppy connection and you weren't able to get the complete details of the history and you misdiagnose the patient, and that causes a problem in the diagnosis, or the lack of proper informed consent, also violation of confidentiality and data privacy, and negligence from online or telephone prescription. So there is a lack of accessible information on medical malpractice using telemedicine in the Philippines because telemedicine is basically a new field in this country. So this is taken from the Harvard Medical School online education. The telephone and the the use of telephone and telemedicine. So they enlisted the pitfalls of telephone care. So you have poor training, delayed management, inadequate or missing documentation, confidentiality breach, you have a lack of follow-up and prescribing problem. So I noticed from the Harvard Medical School online education that there is differences in Philippine medical practice from the United States medical practice, wherein, like in the US, medical license is sometimes state-based. You cannot cross states for you to practice. Of course, in the Philippines, you can practice in the whole country. And in the US, you are basically part of a team. So this is a team-based practice wherein you have different doctors or group practice. You have nurses, attendant, and receptionist. And sometimes there's a problem in the if you, for example, there's a poor training in the nurses, attendant, receptionist, and when the patient calls for a consultation or teleconsultation or telephone concern, the receptionist or attendant cannot answer correctly. So that's where the problem occur. But in the Philippines, is basically a single practice, or sometimes we have a group practice, but basically a doctor to patient practice. And in the US, you have the malpractice insurance. So what are the minimum competencies to practice telemedicine? So first, you should have the knowledge on your field of medicine and the knowledge on telemedicine. And you should have the attitude to perform telemedicine. Second, you must have the technology and the skills to navigate the technology. So what are the minimum requirements to set up for telemedicine? So first, you should have the hardware, which means the landline, cell phone, mobile tablet, computer. Second, you should have the software. So these are the telemedicine software and application. So this is a study done by Sutikno in 2016 comparing four communication applications, namely WhatsApp, Viber, Telegram, and Telegram with secret chats with different security criteria. And you notice in the criteria, it says there, is the communication encrypted or locked? Or does the provider has the lock to unlock the communication details? And if you can see here, WhatsApp and Telegram are pretty secured compared to Viber. So there's a law in the US called the US Health Insurance Portability and Accountability Act of 1996, or HIPAA. So this is a federal law that required the creation of national standards to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. So basically, um, any technology must have a HIPAA um, or must be a HIPAA compliant. So these are the HIPAA compliant telemedicine software. So you have the Skype, UpDocs VC, Zoom for healthcare, the Doxy.me. You have the Google Hangouts, the Cisco WebEx meeting that we used before, GoToMeeting, etc., etc. So you can see here, we cannot find Viber or Facebook Live or TikTok. So next is the internet connection. So this table summarizes the recommended minimum bandwidth speed for different types of healthcare providers. So for example, for a single physician practice, you only need a 2 Mbps for you to have telemedicine. But if you have the whole hospital relying on your internet connection, you must have at least 100 Mbps. Next, you should have the office or private space and appropriate or so what are the components of a quality telemedicine? So like in a face-to-face consultation, we should ensure a quality of care. So this is a table on how to conduct a high-quality teleconsultation. So you must able to convey the value of your welcome. You must introduce the technology for the first-time users. You must collaboratively set the agenda, and you must express empathy, reflect listening, and you should provide closure to the patient. Also, you should verify the identity of the patient. You should ask the patient her name and different identifiers. You should also protect confidentiality and obtain informed consent. So these are samples of informed consent from the Medical Informatics Unit Guide. So one is in English and one is in Tagalog. So the doctor must also prepare a contingency plan or plans in case the telemedicine does not push through. For example, there's a problem in internet connection. So as a contingency plan, you can ask your patient to submit or send you a copy of the laboratory results, and then you will communicate through text or through audio call. So that's a contingency plan. Um, you should also document the consultation or teleconsultation adequately. In fact, documentation is an important factor of teleconsultation. However, the Data Privacy Act of 2012 says that all recording must have been consented by all parties included in the consultation. So the patient should also give consent for the recording. And lastly, issue a valid e-prescription if needed. So the Philippine FDA issued a circular in March 2020 stating that the electronic prescription written by the doctor sent through a messaging application to the patient must be accepted in all pharmacies and drugstores. So electronic prescription is equivalent to a written prescription. Likewise, the Dangerous Drugs Board released a circular on the use of electronic yellow or special prescription form for dangerous drugs that it can be accepted provided it contains all information needed in the yellow prescription and the word no refill is written in the electronic copy. Lastly, you should encourage feedback and monitor outcomes that may arise from the teleconsultation or telemedicine. So this is a sample patient feedback questionnaire that you can get from the Medical Informatics Unit guide. So here are the questions in English or in Tagalog. So this is the process flow that a doctor must perform before, during, or and after teleconsultation. So before teleconsultation, you should prepare the technical setup and the room location. You should also determine if the patient is suitable for telemedicine. You should also prepare the patient's medical record and check if the signal is good, the audio and the video, and on your part and on the patient's part. And also introduce yourself to the family and to the patient and secure consent. During teleconsultation, you should have a agreeable agenda. You should determine how you will explain on how will you get the information needed for the diagnosis and treatment, and conduct your history taking and virtual physical examination. And during this time, you can get patient's feedback. After consultation, you should summarize key points and ask clarification, similar to what you do in face-to-face consultation. And give or explain the e-prescription instruction, explain the plan and the laboratory tests needed, etc., etc. So this is the process flow on the patient side. So before teleconsultation, of course, the patient should schedule a teleconsultation with his doctor. And depending on the agreement of the patient and the doctor, The patient can pay the fee before or after the consultation. The patient must also read, sign, and send the informed consent to the doctor. And the patient must prepare for the teleconsultation. She should do some research on the symptom of the complaint, prepare all the documents needed, for example, laboratory or imaging result, prepare the technical setup or the location, and also check the internet connection, the audio, and the video settings, similar to the doctor. And also come in appropriate attire. During teleconsultation, the patient must come on time, not late or not too early. Full cooperation and active participation of the patient and the doctor. So make notes and ask questions. Ask for a recap for the diagnosis and management plan and follow-up care. During this time, the patient can give feedback. So after consultation, the patient can still give feedback and evaluate the teleconsultation system. So for majority of times, a thorough history gives us a lot of information as to what's the diagnosis of the patient. So physical examination confirms that diagnosis. Physical examination becomes tricky in telemedicine because almost always we only rely on inspection. So these are the different parameters or component of virtual physical examination depending on the organ uh, involved. So you have the eyes, you have the musculoskeletal, you have skin. Of course, most of these are based on inspection. Aside from the inspection in virtual physical examination, you can ask the patient different maneuvers to help you to do in doing the physical examination. So for example, you can collect information. For example, blood pressure. You can ask the patient to have her own BP apparatus or pulse oximeter. Another way is the patient can have a vulvar examination on her own. Or, for example, there's a skin lesion, you can ask the patient to have a camera angle perpendicular to the skin lesion so the doctor can see. So these are the different maneuvers that the patient can do to help you in doing a physical examination. With the exception of abdominal and external genitalia examination, gynecologic examination, particularly pelvic examination, is not possible through telemedicine. So this is one of the limitations of telemedicine in obstetrics and gynecology. So the goal of teleconsultation during the COVID-19 pandemic is to lessen the face-to-face visit and not totally eliminate or not totally do a face-to-face consultation. So what are the applications of telemedicine? So who are the patients who will benefit from telemedicine? So follow-up patients who just need monitoring or reassessment. So those patients who will just show you additional test results. Some patients who will get simple tests. You may ask them not to go to you. You will just send them the copy of the result. Some patients who were just discharged, for example, post-op patients, you can do teleconsultation or telemedicine, and to show the patient will show you the wound example. So this is a very busy slide, but this is just to show you the different subspecialty or specialties using telemedicine. So you can see cardiology, well, particularly dermatology, because primarily they are on inspection. You have endocrinology, neurology, ophthalmology, pediatrics, etc., etc. So this is a sample of patient appointment categorization. This is taken from the National Health Services in London. So you can see here, there's an urgent face-to-face if the patient is a newly diagnosed type 1 diabetes. There's a declining renal function test or urgent training for other devices. So virtual or telemedicine if the patient is follow-up or an old patient. And you delay or defer appointment if the patient's diabetes is stable or well managed. And if the education can be done through the internet, so you can defer appointment. So let's go to the application of telemedicine of obstetrics and gynecology. So for general OBGYN and for low-risk pregnancy, so these are the application of telemedicine. First, you can do telemedicine in preconceptional care and counseling. You will talk about history, obesity, smoking illicit drug, genetic counseling, behavioral modification. In infertility consultation, in contraception, you can do it in using telemedicine because most of these are require patient education and you can do that through telemedicine. Prenatal care, first consult of course, face to face. However, you can also do first consultation prenatal care, especially if the pregnancy is too early. Um, there. For follow-up, you can do telemedicine and check for the patients if the patient has new complaints or check for the lab results. So this is taken from Williams 25th edition on the prenatal care. So this is the routine prenatal care. So on the first visit, you should do everything. So you do physical examination, you have the complete history, and you do laboratory workups. And as you can see, check for the pelvic and cervical examination. You can only do that on your first visit and probably when the patient is already term pregnancy. Um, you can do blood pressure monitoring remotely using a mobile app, or you can ask the patient to go to health center to do the blood pressure monitoring. The patient can monitor her maternal weight um, remotely also. The patient can go to the nearest health center for the fundic height and fetal heart rate. So for laboratory tests, you can ask the patient to show you through telemedicine um, all the laboratory tests you requested for her. So these are the different mobile applications that the patient can use. So the first three, the upper part are weight trackers. So the patient can monitor her weight gain during her pregnancy. The patient can also monitor her heart rate using this mobile application. And also the blood glucose monitoring or uh, log up applications if the patient has diabetes mellitus or GDM. So these are the applications of telemedicine in high-risk pregnancy. So in hypertension, telemedicine can be used to triage patients based on symptoms. So telemedicine can also be used to remotely monitor blood pressure and monitor the response of patients to the treatment and to manage preeclampsia. In diabetes mellitus, the patient can use mobile apps to log and to monitor her blood sugar levels and to use in weight management and monitoring. Telemedicine can also be used in ultrasound fetal monitoring. So, in this case, ultrasound can be done in a nearby sonologist and the recording can be sent to a maternal fetal medicine expert for interpretation. First consultation of a gynecologic cancer patient is preferably a face-to-face consultation, primarily to perform a complete physical examination, thorough history, discussion of the diagnosis, and treatment option in fact, can be done through telemedicine, but should also be discussed during the first face-to-face consultation. Follow-up consultation should also be set during the first visit, preferably through telemedicine. So when do you do telemedicine in cancer management? So first, you can do telemedicine to check on your patient post-operatively. So check for the presence of signs and symptoms of surgery complications. You can also inspect the wound through video call or teleconsultation. Second, you can do telemedicine to discuss histopath cancer result and to discuss cancer management options uh, regarding the histopath result. Third, you can do telemedicine during chemotherapy. Now, I usually send my patients electronic lab requests for the chemotherapy, and then they will email me or send me the results. Then I will send pre-chemo medication electronic prescription and chemo orders. We only see each other during the chemo session, or sometimes I do pelvic examination during this time if needed. You can also do telemedicine during cancer surveillance post-treatment. So when do you do telemedicine at first consult? So, so when you receive referrals from other doctors, you try to screen these referrals through telemedicine. Sometimes I receive referrals with ASCO's result, and the patient is told to undergo colposcopy. And we all know that colposcopy is not the first option for ASCO's. So you can educate the patient regarding the ASCO's result and what's the option. So short of physical examination, you can also discuss the management of endometrial or cervical cancer through telemedicine at the first consult. You discuss surgery, you discuss chemoradiation to the patient. Third, for patients with vulvar lesion or symptoms or cancer, you can do teleconsultation first. So ask the patient to take a picture of the vulva and ask to show you. So you could also ask the patient or relative to palpate for inguinal nodes. So, so if you see a patient like this in the in a teleconsultation, for sure you will think of ovarian cancer. So history of abdominal enlargement and weight loss can clinch the diagnosis of ovarian cancer. So for this case, you can do teleconsultation to discuss your surgical management, and you can give electronic preoperative laboratory requests, and you should also give electronic referral to other doctor for CP clearance. You don't need the face-to-face consultation for this. You can do the public examination when you see each other, or you can send the patient to the emergency room for admission. These are few of the mobile health applications that you can use in cancer management. So the first one is a cancer treatment calendar. So this is to schedule the patient's chemotherapy session for the patient not to forget about her session. The second one is a personal health record or personal medical record, wherein you can record all the medication the patient is taking and the complete diagnosis or the complete medical condition. This is very important, especially in patients who are terminally ill. So usually they go to emergency room late at night. So the ER medicine will ask the patient or the relative what's the complete diagnosis. So the relative can just show this application with a complete history and or complete diagnosis. Okay? So in summary, we talk about the basics of telemedicine. So what the doctor and the patient need to know during in telemedicine, and the application of telemedicine in general and in obstetrics and gynecology and in gynecologic oncology.